Barrow's provides the most amazing high level of rehabilitation. We have a very strong clinical presence. We're definitely the referral place of choice for neurologic rehabilitation, spinal cord injury, complex stroke patients, that sort of stuff. And we're definitely the outpatient referral source as well. The biggest challenge is we're trying to get people better faster. In the inpatient world, when I started, 2 to 3 months length of stay was normal. Now I usually quote people 3 weeks, and we probably are on the high side. 3 weeks is like next to nothing, 21 days. So you need to get as many repetitions as possible in there. What I had heard from the therapist was, we can't get them on the treadmill. It takes 3 therapists to work with them on the treadmill. It doesn't translate to real overground walking. And I saw the Ekso and I said, wow, all the things that the therapists were complaining about is fixed by this device.
We're really limited in what we can do with our hands, and having a device like the Ekso helps with a lot of things that we just physically can't do.
Well, as a nurse educator, I was aware of the Ekso, but I had never seen it. I was really excited. The first time of standing up in the Ekso was an empowering feeling. It was just like I was on top of the world.
We need to do things that make patients able to do as many repetitions as possible. The repetitions need to be good, and we need to adjust the way that we provide them the therapies, because each patient is different. Devices like this, I think, allow us to be more effective in the time we're spending with the patients. It also allows us to do the steps well, which I think is really the key. It's not just the number, but it's the quality of them, and the quality is just so good with this device.
And we got a second Ekso because we wanted to have that continue over into outpatients. They can go longer and longer distances, and then as they're able to start walking longer and longer distances, they're able to begin walking in the community. They're able to get back eventually to their normal life. For patients that are just so dependent, who would usually go home in a wheelchair, we're finding that those patients are progressing far beyond what we've ever been able to get them to, because we have this means to be able to get people up earlier and to get them to have that experience of being up and moving that they're not able to have otherwise.
One of the things that we've set as a goal for our institution is to really be on the forefront of technology that's being used here on a day in and day out basis for rehabilitation. I want patients to use the technology so they're better, so they don't need to use those devices every single day at home.